So today is September 14th, 2010, and this is now approximately 20 months after your ketamine coma, okay? And so in brief, let's just say you came back about a month after your ketamine coma, evaluated at that time. And apparently the blood pressure cuff on the good side, that is your right upper extremity, triggered some RSD over there. We treated you with a 3-day ketamine treatment, and that significantly helped your pain, okay?
Yes.
And we didn't have to worry about ulcers, which we're now a little concerned about right now because you didn't have any after the ketamine coma, 1 month after ketamine coma. Now you've got some resumption of ulcers there.
Very painful ulcers.
Yeah, so the bottom line is the 3-day ketamine treatment we gave you, up to 135 milligrams an hour, benefited you quite significantly back then. In the interim, up in Canada, you've had ketamine infusions there. And unfortunately, they do the infusions once a week, and I've already indicated to you, to really be effective, you've got to do at least 3 consecutive days, because that's just the way it works. It's not just about getting the dose up, but you got to hold it up there for a period of time.
Right.
So we talked about the disadvantages. And what should have proved that to anyone is the fact you went down to see Dr. Cantu. He ran the infusion for 7 days, not a coma, but a 7-day infusion. And the ulcers dried up, didn't they?
Almost all of them, 80% of them.
80% of them dried
80%,
up.
80%,
right.
Yeah.
So again, the bottom line here, it's not just about getting dose up, but you got to get it and hold it up, okay? So today we did your pain thresholds, and compared to what they were 1 month after your ketamine coma, your pain thresholds have deteriorated, okay? Maybe not as bad as it was before, but they are pretty bad. Now what we need to do now at this point, Blair, we need to go through the inventory on your function. Okay, so let's start with take that as best you can. Take that right hand behind your head. Let's see how you can do there. That's it. Are you having pain when you do that?
I do.
And where do you have the pain? Just kind of point to where it's at.
My fingers.
Yep.
And in my bicep right here.
In your bicep? Okay, good. Now, on the other hand, the worst side, of course, is your left side. See how far you can get that up there without causing an enormous amount of pain. Yeah, so there's a significant, been a significant well, you've just deteriorated there, okay?
Yes.
Now, and of course we see the ulcers here, and there's lots of scab, which is a good sign. It means it's probably not infected. Now, we did talk about these scabs, and the best way to promote healing is through heated pool exercises. And the Canadians have got to get you set up with a facility that allows that to happen, primarily so that there can be some debridement that takes place, so that it would minimize the risk of infection. Okay, that's really, really important. Okay, if you can get some exercise when you're in the water, that's even better. But you do need to have the water to facilitate debridement, because if you get an infection down there, I'm not here to scare you or anything, but I've seen it where the infections can get so bad and patients get blood poisoning, septicemia, end up having to have an amputation done. So it's a serious potential problem that needs to be addressed appropriately.
So is my pain a serious problem?
Right, it is. All right, we got a little sidetracked there, but let's go ahead and finish our examination here.
Okay.
Why don't you take that better hand, which is your right hand, and do the vertical finger test. See if you can get 2 fingers in your mouth without pain. Vertical, up and down. Are you having pain when you do that?
Yeah. All right. Can't open my mouth.
Take your fingers out so we can talk.
Can't open my mouth up any more than that. I get pain.
Right. And where do you have the pain when you open your mouth?
Pain in my
especially on that left side, correct?
Yeah.
Okay. Take the right hand out in front of you like this. Open and close as fast as you can. Fast, as best you can. Okay. Do the best you can over here, John. Blair, I'm sorry. Go ahead. There you go. And as a matter of fact, that's better than you did before the ketamine coma, okay? But it's still, you've lost some ground since we saw you 1 month afterward, okay? Next, what we want to do, we know you have sensitivity of the skin on that side, so we don't have to do anything there. It's sensitive to light touch, right? Very light touch?
Right.
Yeah, okay. Now, I want you to take off your sandals on that right side. There you go. Rotate your ankle for me. Show me what you can do. Rotate. Good. Wiggle your toes for me. Good job. Okay. Hitchhike back to Canada. Put that big gold toe up on that right side. All right, you smarty. All right. I'm going to call you Bad John from now on. Wiggle your toes over there. Good. Okay, I want you to get up there and go by the door, please. You notice we have a new floor here. Did you notice that?
Yes, there's no threshold.
There's no threshold.
love that.
Right, you love that, right? Okay, walk toward me, please. That's good, good. And walk on back the way you normally walk. Okay, very good. Now, Blair, turn around and tell me, did you have pain when you did that?
I have pain in my hips.
In your hips? That's where you felt it the worst? Was it more on the right or the left?
I'm more on the left side.
On the left side? Okay. Now, I want you to hold his hand for safety reasons.
Just come on this side.
Yeah, get on his right side.
I'll just
And if you need them, use them. But if you don't need them, don't. I want to see how well you can do on your toes. Okay. Couple of steps. There's one. One more step. That's it, John. Okay, that's
Blair.
good enough. Blair, I'm sorry. I got you. Okay, going back there, and I'll explain why it is. There's another patient, as you know, John, and John has it in the same extremity you got it. And I just can't get that out of my mind. Now, I want you to tell me, did you have pain when you did that?
Yes.
And where'd you feel the pain?
I feel it in my toes.
In your toes? Okay. Not in your calves or your knees or anything?
Well, the toes in my hip.
And especially your left hip?
My left
Okay, got it. Okay, now I want you to go on your heels a couple of steps for me, and then I'm going to ask you about how that feels, okay? Very good. Go on back, please. All right, good. Tell me about if you had any pain, and if so, where'd you feel it?
That's not so bad. I just, it's a little discomfort in my hip.
Again, the left hip.
Yeah.
Understood. Okay, very good. Blair, sit down, please, and shut up.
Hey, John.
Okay.
Thanks, John.
All right, okay. All right, now let's talk about the treatment plan here going forward, okay? From a medical standpoint, we've talked about a couple things. I think you would benefit from another ketamine coma at this time, okay?
Yes.
But again, no, I don't have to remind you of the risks that's involved. You're very much aware of that. But I think you need that duration of exposure to help heal up those ulcers you have on your arm. Alternatively, you could have from 4 to 7 day consecutive ketamine, okay? Not in a coma, but I think that would also benefit you, okay? But it has to be done consecutive days, okay?
I've had the consecutive day thing, and it works for a while, and then I just revert back to where I am now, and I just get worse. So I don't know which way to go yet. We'll talk about it.
Sure. No, that's fine. That's fine. So those are the options, to be looking at. In the meantime, we talked about why it's so important to get you into heated pool exercises.
Yes.
Okay, it's particularly take care of the wounds that you have there. Okay,
Yeah.
keep the debridement down. The other thing, John, is
Blair.
That is so important. Yeah, I know. You know who I'm talking. You know why I'm confusing you. You
John
guys,
Rhodes.
I can't.
Hi, John
From the
Rhodes.
neck down, you look exactly the same. The thing that you also are very familiar with is the fact that you got to keep yourself out of a stress ball.
Yeah.
Because stress will just set this whole thing off. Okay.
Absolutely.
We also talked about the fact that you had to go back onto the opioids and on a relatively high dose, and it's important to do whatever we can to substitute that for something else, ketamine, whatever. We want to try to get you off it. Now, there is a place for opioids, and a very vital place for them in the management of CRPS. Acute pain due to injury, that sort of thing. Yes, definitely, you have to take them to control pain in that situation. But for ongoing treatment of CRPS, we really want to try to minimize that, because we do know that it can lead to this phenomenon we call hyperalgesia. In other words, your skin even becomes more sensitive to pain. Now, let's stop and see if you have any questions at all, any concerns you want to express.
Well, just getting to the opiate thing, if I don't take them, I just end up in a bed all day because of these ulcer sores. I mean, they are just, you know, they burn, and they're incredible. And and I have to have some quality of life right now, and if that helps me, I mean, you know what, unfortunately, as much as I hate taking them, I have to do it so I can have some quality.
I want to comment on that briefly. The type of pain you're experiencing now is probably closer to cancer pain than it is closer to the RSD pain, because you got tissue destruction going on. Okay? Breakdown. That's what happens when you have cancer. Whereas we don't see a lot of that in just plain pure CRPS patients. Do you understand that? And therefore, it shouldn't surprise you that the opioids probably are going to work more effectively in someone like you with ongoing tissue destruction as it does in cancer patients. Do you understand that?
Yeah.
Okay? So if you didn't have this, I'd really be pushing you, I'm talking now about the skin ulcers, pushing you as hard as I could away from the opioids.
Absolutely.
But I'm not pushing you as hard as I would other patients. Do you understand why?
Yes, yes.
Okay, I just want to be clear about that.
Like, why, here's a question I have to ask you. Why is there so few RSD patients that get these ulcer sores?
I don't know. I don't know the answer. It's a good question.
Now, is it true, what I understand, that it's the nerves giving off toxins, bad toxins?
That I don't know.
Create?
I don't know. I don't think we really know the answer to that. We do know that ketamine is very useful in decreasing the ulcer formation. That's a pretty well established fact.
Yeah, absolutely. I agree with that.
Yeah. Any other questions?
No, I just want to get better.
No, I understand.
I can't take it anymore. Again.
Right. Well, we found what we've learned over the last year or so is that prior to the ketamine coma, there wasn't anything that was working. Nothing was working.
Yeah.
So there is something that does work. It's just got to be applied properly in your situation, with your particular situation, especially with the skin ulcers. Okay. All right. All right. Let's see if your colleague over here has any. You have any questions?
Peace out.
Oh, you're no questions, right?
No.
All right. Very good.
I'm good.
All right. Very good.